welcome to Chapter 13, Preoperative Medications. Let's get into our learning objectives. We are going to define terms and look at abbreviations. We have to state the purposes of preoperative anesthesia, look at components of preoperative evaluation, discuss the medications that we use preoperatively, and explain the purpose and state examples of each group of preoperative medications. For our terminology, let me break these down for you. We'll start with the first one. Amnestic, a drug that causes memory loss, especially after it's given. Analgesia is the inability to feel pain. Antegrade, memory loss, starting from when the drug is taken. Sedatives, drugs that calm and can cause amnesia at high doses. Analgesics, these are medications to relieve pain. We have anticholinergic. These are a drug that blocks certain nerve signals. They are parasympathetic drugs. We have anticholinergic. These reduce saliva producing. We have our vagolytic. They block the vagus nerve. We have analgesics. These reduce anxiety, aspiration, inhaling something into the airway by mistake. Benzodiazepine, a type of sedative. When we talk about nothing by mouth, we usually say NPO. So you'll see NPO before surgery. And then you have opioids. These are pain-relieving drugs similar to morphine. They're used in pre-op to manage pain. Now, the main purpose of preoperative evaluation is to gather information that is important for the patient, like the medical history, current health status, potential risks. This helps the anesthesia provider decide the best anesthesia plan for the patient. It's a critical step before administering preoperative medications to ensure that there is safe and they are effective. Now, it includes reviewing the patient's medical record, conducting a physical exam, and analyzing test results. It typically has two parts. You have a questionnaire completed by the patient, gathering basic health information, and an interview with the anesthesia provider. This allows the provider to clarify details, answer patient questions, and build trust. These steps ensure the anesthesia plan is safe and tailored to the patient's needs. It also includes a physical examination, which assesses the patient's overall physical condition and airway. Additional tests may be ordered based on the evaluation, such as an ECG. They may ask for a hemoglobin and hematocrit, or H&H, or even a chest x-ray. Forms and questionnaires are just part of the process. The physical exam provides critical information to ensure the anesthesia plan is safe and effective. Sometimes we give preoperative medications. This helps the patients feel prepared both mentally and physically for surgery. Now, the chapter focuses on 4 main types: sedatives to calm anxiety, analgesics, pain management, anticholinergics to reduce secretions like saliva, gastric agents to protect the stomach and reduce nausea. And these include antacids that neutralize stomach acid and antiemetics that prevent nausea and vomiting. These medications are tailored to the patient's need for a safer and smoother surgical experience. So let's break these down just a little bit more. Sedatives are commonly used preoperative to, again, relieve anxiety. They usually cause mild drowsiness and may lead to memory loss. At higher doses, they can cause deeper sedation and antegrade amnesia, which is memory loss after the drug is given. So Benzodiazepines are often used as sedatives, as well as the ones you see in front of you, Valium, Ativan, or Versed. These really help patients stay calm and relaxed before surgery. Analgesics are used for patients experiencing pain, such as trauma patients or those needing invasive monitors placed before surgery. Again, they're trying to relieve pain. Examples of opioids commonly used are morphine and Demerol. These drugs just ensure patients are as comfortable as possible before the procedure. We have anticholinergics. These are not typically used before surgery, but may be necessary in certain situations. That's because they block the vagus nerve, which raises heart rate and reduces mucus in the respiratory and digestive systems. They have different effects in terms of how quickly they work and how long they last. Scopolamine, which is this last one down here, is an example of a drug that falls under multiple categories. It acts as a drug that increases the heart rate and reduces secretions, as well as a sedative, and it also helps prevent nausea. And then there are gastric agents. The stress response in surgical patients caused by anxiety or fear can slow or stop the digestive process altogether, making gastric agents necessary to protect the patients during surgery. These medications help reduce the risk of aspiration, which is inhaling stomach contents into the lungs, which is a serious issue and can cause damage during anesthesia. Another reason why we tell patient NPO before surgery. So here's some examples. You have oral antacids like sodium citrate. We have H2 blockers like Zantac, Pepcid, Tagamet. Now, H2 blockers are medications that block gastric acid secretions, and they inhibit the production of stomach acid. They are usually used for patients at higher risk of vomiting and aspiration. With our protein pump inhibitors, these are our PPIs, these are another type of an acid used preoperatively. Now, these drugs are prodrugs, meaning they are given in an active form and become active once inside the body. What makes PPIs unique is that they are not activated in the liver, but in the parietal cell calyceus. These are the canals where stomach acid is produced. PPIs work by blocking the final step of gastric acid production. They interfere with the exchange of H2 or H+, which is hydrogen, and potassium ions, and they pump on the surface of parietal cells, which reduces stomach acid production. Now, antiemetics and gastrokinetics are subclasses of gastric agents used preoperatively. Antiemetics like Zofran help reduce nausea and prevent vomiting. Sometimes it's combined with dexamethasone for extra effectiveness. Scopolamine is another antiemetic. We have gastrokinetic agents like Reglan. These help stimulate the movement of the upper gastrointestinal tract, which aids in digestion without increasing stomach acid production. Now, these medications are given to reduce the risk of nausea, vomiting, and aspiration during surgery. Now, that's pretty much it. In this video, we covered key preoperative medications used in surgery to help prepare patients physically and physiologically. We learned about sedatives, analgesics, anticholinergics, and gastric agents, including antiemetics and gastrokinetics, such as Zofran, Reglan, and sodium citrate. We understand now how these drugs work to just relieve anxiety, manage pain, reduce stomach acid, and prevent complications like nausea and aspiration. Ideal for us as surgical techs because Now we have a better understanding on the relevance and how this application fits in our world in the operating room. If you have any questions or something just doesn't stick or feel right, reach out with that. That's all, folks.